Hi and hello everyone. Welcome to the Nursing Virus YouTube channel. This is me Loganathan and this video regarding the nursing officer examination which was held by the NORCET the year of 2023, the date of 3/6/2023 on the first shift. The maximum number of questions I am going to cover in this video, that is almost around 120 questions with all four options we are going to discuss. If you're not subscribed my channel, don't forget to subscribe and click the bell icon so you'll get all my video notification. So here we'll go with the first question. So identify the given ECG changes. So this is the image based question they given, and this is one of the common arrhythmias we can see on the ECG findings. So where the person having either atrial flutter, ventricular tachycardia, ventricular fibrillation and sinus tachycardia. By seeing this distance between the PQRS changes, we can say that it is one of the atrial flutter. And the second question, a 3-year-old child brought first time to the psychiatric OPD, and during the history, the parent said that he is not having communication with other children in the school and not joining the play activities and doing some kind of tantrum. On his intellectual activity, there is no problem. Always sitting alone and doing the repeated kind of playful activities. And what is the condition of these children? So on this given question, we can note it down. So when the child is not having a proper communication, that is one of the autism sign. There will be three common trait, that is a communication and social isolation and a stereotype pattern of behavior. So these all three things we can see in the autism spectrum disorder, or it is known as autism. So the child does not have any intellectual problem, and attention deficit also that need were not fulfilled because the person is not having any inattention or hyperactivity, and there is no chance of MR. So the correct option is autism. The third question, again image based question. So identify the given image. So the options are Venturi mask, non-rebreathing mask, rebreathe mask and oxygen face mask. So we can see that the bag attached along with the face mask, that is called as NRB mask, that is a non-rebreathe mask. Fourth one, human developmental index. The components are, the options are life expectancy at birth, literacy rate and standard of living, and life expectancy at 1 year age, education, standards of living. C, life expectancy from 1 to 5 years and standard of living. So the correct answer is the first one, the life expectancy at birth and literacy rate and the standard of living. These are three components of the human developmental index. The fifth question, again image based one. A 5-year-old child have a red, itchy sore as its heals, a crusty yellow or honey colored scab from the form over the sore in the chin area. Here the honey colored scabs. So the options are dysphotic eczema, impetigo, atopic dermatitis and contact dermatitis. So honey rust color area we can see only in the impetigo. So this is the correct answer. So the next one, a male came to the OPD with the complaints of hearing of voice and having a suspiciousness over the family members and not staying at the home properly, and by the appearance not maintaining the proper hygiene since last 2 weeks. So what is the diagnosis of this client? Schizophrenia, schizoaffective disorder, acute transient psychotic disorder and mania. So most probably if you are looking the symptoms, it may fulfill the symptoms of schizophrenia, but whereas on the durations they given as the only 2 weeks, so it will not come under the schizophrenia because the schizophrenia cases the 1 to 6 month the symptoms need to present, so the schizophrenia will not come. And schizoaffective disorder also it will not fulfill because the schizophrenia and as well the affective symptom need to present. So schizoaffective will not come. And the last one, mania. So there is no symptoms of the hyperactivity or the grandiose ideas. So the mania also will not come. Here, the remaining option, the acute transient psychotic disorder. So this is a form of acute schizophrenia we will use to call, where the symptoms similar to the schizophrenia, but the duration were less than 1 month. So the correct option, acute transient psychotic disorder is the correct one. And seventh one, identify the type of infectious condition in the given image. The options are tinea barbae, tinea corporis, tinea pedis, tinea capitis. So the round ring-like structure will use to present in the tinea corporis. So the remaining thing will use to present over the scalp or in that knee area. That is the other tinea infections. The next one, the patient with the prescription of haloperidol 50 mg for the 1 week, he developed the following symptoms like experience an intense sensation of unease or an inner restlessness that usually involved in the lower extremities. The options are dystonia, akathisia, tardive dyskinesia, Parkinsonism disorder. So where the person having a haloperidol, there will be chance of developing the EPS. So all the four symptoms related with the EPS only. So we need to look out the duration within a 1 week. So and as well the person having the restlessness and that in motor involvement will be present in the lower extremities. This will be very common in the akathisia symptoms as one of the earlier symptoms of EPS. The next one, identify the type of surgery which the instrument is used for. So this is one of the retractor and it will be either used mastoidectomy, thyroidectomy or mastectomy. So this is a very common instrument were used in the thyroidectomy patients. That is a thyroid gland retractor. The next one, chest X-ray. So identify the chest X-ray, pneumothorax, pleural effusion, and pneumonia. There will be a blank white space we can see in the left side lower lobe. So this will be very common in the effusion cases. So that is the among the given option. The pleural effusion is the correct one. The next one, after 7 days of neonate, the assessment were carried out and you are finding that he is having the jaundice and part 3 alone looking yellowish discoloration. According to the finding, what is the bilirubin level of expected in the lab finding? So this is also one of the image based question. So based on the Kramer's scale, they asked the bilirubin level. So the given area, indicated area is only that groin areas and that lower extremities, sorry, upper extremities. So based on that Kramer's scale, the face indicate 4 to 6 mg, upper chest and abdomen 8 to 10 mg per dl, and lower abdomen and thighs 12 to 14 mg per dl, and arm and lower legs 15 to 18, and palm and sole number 5 indicate that is 15 to 20. So according to the given option, the 12 to 14 mg per dl, the expected bilirubin value for these children. Next one, under 5 mortality rates they asked. This is one of the direct question. So the formula they asked and the options, that is the total number of death of under 5 children from 0 to 5 years in a given year and locality divided by total number of live birth in the same year and the locality into 1000 population. That is 1000 live birth. The next one, 13th. So according to the WHO, the stunting is considered if the height of the age is so more than 2 standard deviation below the child growth standard mediation, and other options just they varied with the standard deviation, that is a 5, 1 and 4. So according to the WHO, the stunting is considered if the height of the age is more than 2 standard deviation below the child growth standard median. So this is the correct option, the definition for the stunting consideration. And 14th one, the patient with congestive heart failure, the lab value showed that potassium 6.5 milligram mg per dl. So these indicate in the ECG the changes: ST segment elevation, ST segment depression, tall T wave and flat T wave. So here the person is having the excessive level of potassium, that is a hyperkalemia. So it can be seen with the patient where the ECG will used to rise in the T wave. So other two is mainly indicated in case of myocardial infarction and angina cases. The next one. So what is meant by double depression? The depression that occur two times in a 1 year period, the depression that occur with low symptoms of the 2 years of period, and the depression that occur two different causes and the twice a time. So the double depression is mainly indicated as dysthymia. Dysthymia. So the dysthymia definition is nothing where the person having the chronic low level of symptoms for at least 2 years of period. So according to the given option, the B is the correct one. The next 16. On the psychiatric interview, the patient had the following thought sample: hey, may, pay, re, day. So this is the sample of, so that is a something the word were made funny rhyming. It will be indicated as neologism, clang association, and derailment and loosening of association. So where the person having the rhyming of the particular words, it is called as clang association. Then 17th question, up to which age group the height of the child measured in lying down position? 9 months, 12 months, 24 months and 36 months. So from the birth to till the age of 2 years, the child height will be measured in the lying down position. So the 24 months is the correct one. The next one. So Elizabeth Kubler-Ross has described the grief process. So based on this, the woman having feeling of sad and hopelessness about her loss. So what is that stage according to this assessment? Denial, bargaining, depression, and anger. So the grief process we're having the 5 stages that is under considered as DABDA, that is the denial, anger, bargaining, depression, and acceptance. So the sad and hopelessness about that loss will be perceived in the depression stage. So the correct option is C, depression. The next, the client in the emergency condition for the fastest 30-point scale used for in the assessment in the psychiatric patients. The first option, mini mental status examination, and second one, delirium assessment scale. So where the person having the indicated of 30-point rating scale in a psychiatric, that is considered of 6 components and the fixed number of questions, which is indicate that mini mental status examination. So where the patient having up to the 25 to 30 score will be considered as normal. A newborn baby had pneumococcal meningiocele. Till the period of surgery, the sac should be well protected by covering it with a sterile gauze piece soaked in spirit, normal saline, methylene blue, and betadine. The lumbosacral meningiocele should be always covered with the normal saline to prevent the further infections. The next one, something which is related with the spelling. So identify the correct spelling in the following word, that is the puncture. So the first option is the correct one. This is a grammatical correct spelling for the puncture. The next one, the patient have 500 ml 5% of dextrose to be administered in 5 hours with Bruti sets. So what is the flow rate? So here it is somewhat just a tricky question. That is a Bruti set always used for the pediatric. that is the considered as microtrip set. So here in the microtrip set, it will be considered as 1 ml is equal to 60 drops. So this is the drop rate. So the 500 ml will be given with the 60 drops divided by total hours will be 5 hours. That should be converted into the time, that is 60. 60 can be divided and 5 can be with 100. So 100 drops in a microtrip set is the correct option. The next one, G20 summit, which country has not included? Under the G20, there will be totally 19 countries will be included. So here, which is not included, that is the question. The options are Brazil, Canada, Pakistan, and China. The Brazil, Canada, and China were included among the G20, so except the Pakistan. The next one, fill in the blanks with the correct reposition of the following statement. You can cut the cake dash a knife with, in, through, by. So here the correct option is with. You can cut the cake with a knife. So this is the correct repositioning word. The next one, the snow or winter carnival festival was organized by Jammu and Kashmir, Himachal and Ladakh. The correct option is Jammu and Kashmir. The osmolality of plasma in a normal adult is 260 to 270 osmosis per liter, 320 to 330 osmosis per liter, 280 to 290 osmosis per liter, 300 to 310 osmosis by liter. So the correct option is 280 to 290. So this is the normal osmolality pressure of the plasma in adult. Next 127, which number blade is used for insertion in the abscess cases? Blade number 10, 11, 12 and 26. So the commonly 11 blade size is considered as the normal blade size for the making insertion over the abscess. Next one, you are doing the tonic fork assessment and checking for the vibration sensors. So the energy used for this one, 128 HSZ and 2480 48 hazards and 512 and 1240. So the normal vibration should be used between 128 to 270. So according to that, the first one is the correct option. The common sign of patient with alcohol withdrawal, aggressive behavior, vertigo, tremor, and dizziness. So even the person having the aggressive behavior, the tremor will be considered as the most number of clients. The delirium tremens is one of the common withdrawal sign. The next one, the gastric lavage procedure should be avoided in arsenic poisoning, kerosene poisoning, and organophosphate poisoning. So in case of kerosene poisoning, the gastric lavage will not be done. And 31, the type of fluid which pass from the bloodstream to tissue is normal saline, isotonic fluid, hypertonic fluid, and hypotonic fluid. So here, so the hypertonic fluid always will pass from the bloodstream to tissue area. The next one, the client in an accident and suspected to have the C4 cervical fourth number damage in the emergency room. The priority nursing intervention for this patient is option A, confirmation of the spinal cord injury, check the airway and stabilization of the cervical spine, and normalization of intravascular fluid volume. So the first almost emergency care in case of cervical fracture, we need to check the airway and first we need to stabilize the patient. That means the stabilizing the cervical spine. We need to immobilize the particular area. So option B is the correct one. 33. When the nurse teaching a mother of a 4 months old with a diarrhea about the importance of preventing dehydration, the nurse would inform the mother about the importance of feeding her child is diluted carbonate drinks and fruit juice, regular formula mixed with the electrolyte solution, and soy-based lactose-free formula. So this is the main thing. Suppose in case if you are giving those things, the person will used to get uh, if we are giving the lactose, the person will get the further leads for diarrhea and dehydration. So we need to give free of lactose and soy based diet to the child. The next one, an 8 years old child come to the OPD complaining of swelling and pain over the knees. His mother says that the swelling occurred for the no reason and it keeps getting worse. The initial diagnosis of limb disease. When collecting history from the mother, which of the following question would be important for further action? So decreased urinary output and the flank pain, rash covering the palm of the hand and the sole of the feet, a fever of over 103 Fahrenheit occurring over the last 2 weeks, headache, malaise, and sore throat. So the patient need to be collected about the headache and malaise and sore throat. So this is the very important care which will be needed to treat the Lyme disease. And the next one. The location of apical pulse is between second and third intercostal space, mid-clavicular line, between fourth and fifth intercostal space of mid-clavicular line, between fifth and sixth intercostal space of axillary line, and between the mid-sternum. So this is one of the basic question. So between the fourth and fifth intercostal space of the mid-clavicular line, the apical pulse need to be checked out. The client with the neck of femur fracture, the positioning of the leg should be external rotation less than 45 degree, external rotation more than 45 degree, internal rotation less than 45 degree, internal rotation more than 45 degree. So here, so the extremities where the person having the neck of femur fracture, the extremities should be kept with the external rotation less than 45 degree angle. So after the liver biopsy, the recommended position of the client is supine position, prone position, right lateral position and left lateral position. So the correct option is right lateral position. That will make the persons to avoid the further infection and further fluid leakage. So what is the best position to keep a 12 years old child after the lumbar puncture to assess the CSF? Semi-foulers to assist the child, so that can be help the child to watch the TV and make the child to get entertained. Supine position for the several hours so as to prevent headache. On the right side to prevent the leak of the CSF. Prone for the 2 hours to prevent the vomiting and aspiration. So commonly after that CSF, the supine position need to be maintained for the several hours to prevent the further headache of the procedure to the patient. 39. A nurse taking care of the patient with a chest tube drainage suddenly noticed that there is a no fluctuation in the bottle, that means the water seal tube. Which of the following actions should the nurse take first? Turn the patient to an unaffected side, inform the physician, check the tubing to ensure there is a no kinking, start milking the chest tube. So first we need to, if there is a no any kind of bubbles or the no fluctuation over the water seal, first we need to check there is any kind of kinking over the tube. There will be any kind of an twisting or a blockage over the tubes. We need to check it out first. The child with a tracheoesophageal fistula, the nurse need to place the patient in the prone position, side lying, semi-foulers and right lateral position. So where the person having problem in the upper either upper GI or in the respiratory area. So always first we need to prefer for the semi-flawless position, that is the 30-degree. Initially the bed need to be elevated. Next one, following are included in surgery safety except time in, time out, sign in and sign out. So this is one of the repeated previous year question paper question. The person will not need to have the time in. So the remaining three will be present in the surgical checklist, safety checklist. Next, 42. The state recently changed the name as Sambhaji Nagar, that is the Aurangabad. So these were changed with the name of Sambhaji Nagar. And polyuria is not commonly in diabetes insipidus, mellitus, pyelonephritis, and glomerular nephritis. So in case of diabetes insipidus and the diabetes mellitus and pyelonephritis, the person will used to have the polyuria is very common sign of those condition. So except the glomerular nephritis, the person will have the polyuria in the remaining condition. So the correct option is glomerulonephritis. Next one, thiamine deficiency can cause gingival bleeding and memory loss. So the thiamine can be a major source for making the persons to get brain changes. That is a memory loss will happen in the initial stage of the patient with mostly in the alcoholic patient or the dementia patients. It is very common. The next one, the nurse preparing the mother for discharge. What she need to educate the mother regarding breastfeeding. Breastfeed the baby every 4 hours. Breastfeed the baby every 1 hour. Breastfeed the baby when crying. Breastfeed the baby 4 times in a day. So according to that breastfeeding guidelines, baby friendly hospital. So whenever the baby were in the need of hunger, the child will use to make the cry. So whenever the child were crying, the mother need to feed the baby. This is the initial breastfeeding technique or the as an intervention or the teaching we need to give it to the mother. 5% of dextrose solution having the how many calories? 170 kilocalories, 100 kilocalories, 120 kilocalories, and 500 kilocalories. So basically, the dextrose solution, 5% of dextrose solution having each 100 ml, the person having 170 kilocalories. So which of the following is the correct height velocity in the children aged 2 to 10 years? The height velocity will be considered for the children is 8 to 18 centimeter per year, 4 to 6 centimeter per year, 2 to 6 centimeter per year, 6 to 8 centimeter per year. So the height velocity according to the WHO, the 4 to 6 centimeter per year will be considered as normal one. Next question, 48. A pregnant woman comes to a OPD first time for the prenatal examination at 10th week. She has been pregnant twice before. The first procedure produced a viable baby at 39 weeks on 3 years ago. And the second pregnancy produced viable baby at 36 weeks 2 years back. Both children are living and well. Using the GT-PAL makes the record of her obstetrical history. So for the GT-PAL, that is a gravida, term baby, and preterm, abortion, and live birth. So according to the given information, the mother were totally pregnant 3 times. That is the 10th week now, and 39 weeks first baby, and 36 weeks the second time. So the total pregnancy will be 3. That is a gravida. So next one, the term baby. The 39 weeks will be considered as term, and 36 weeks will be considered as preterm. That is a after 38 weeks, it will be considered as term. Before 38 weeks, that is a preterm. So the term is 1 and the preterm will be 1. There will be no history of abortion, and here the both baby currently were living well, so the live birth will be 2. So according to the given option, the C, 31102, that is the correct option. A client is being admitted in the hospital for induction of labor with a gestation of 42 weeks, confirmed by the date and ultrasound. On the assessment, she is having 3 centimeter dilatation and she have contraction on each 17 seconds, and she is receiving continuous oxytocin. The nurse first intervention after finding this through the examination, noticed by the physician, check the fetal heart rate, turn off the IV oxytocin, and prepare for the delivery because the client is probably in transition. So whenever the child is having the less contraction, so after having 3 centimeter of dilatation, and as well she is the postnatal mother, so she should be stopped immediately for the IV oxytocin that will make worsening of the fetal heart rate. The next one, the burns calculation. So on the burns patient, the common fluid used for the treatment is Ringer lactate 4 ml into percentage of total body surface area, and normal saline into percentage of total body surface area. So the commonly for the burns patient, the 4 ml Ringer lactate will be used for the client. So the option A is the correct one. The next one, inferior epigastric artery is the branch of internal iliac artery, external iliac artery, and femoral artery and gastric artery. So the correct option is the patient is the inferior epigastric artery is the branch of external iliac artery. The next one, 52, most common cause of pyogenic meningitis in adult: pneumococcal meningitis, E. coli, Streptococcus aureus, Haemophilus influenza type B. So the pyogenic meningitis, the common reason is Streptococcus aureus. The early symptoms of meningitis in the neonate: poor feeding, bulging fontanelle, headache, and high-pitched cry. So in the case of neonate with the meningitis, the high-pitched cry will be considered as the early symptom. 54. As per the Gazette guidelines for the assessment of person with a disability, which tool is used to assess the mental disability for the purpose of certification? Indian Schedule for Disability Assessment. B. Indian Disability and Emotional Assessment Schedule. C. Indian Disability Evaluation and Assessment Scale. D. Indian Scale for Assessment of Mental Illness and Disability. So the correct option is Mental Disability Evaluation and Assessment Scale. So this is the right scale for assessing the person disability and can produce the certificate. 55. After starting the blood transfusion, the patient developing the chill after the 30 minutes of blood transfusion. So what is the first nursing action? The stop the transfusion, document the finding and continuing the transfusion, administer antihistamine, and inform the physician. So as per the guidelines, whenever we are having any kind of reactions after that immediate blood transfusion, we need to stop the transfusion. This is the first intervention. Then we can inform to the physician. This is the second intervention. So option A is correct one. 56. You insert an IV cannulation in external jugular vein and administer a drug through the IV cannula. So the pathway of the drug reach the heart is based on the following: external jugular vein, subclavian vein, and to the heart; external jugular vein and internal jugular vein, bronchocephalic vein, and to the heart; external jugular vein, bronchocephalic vein, and heart; external jugular vein, subclavian vein, and bronchocephalic vein, and to the heart. So the correct option is D. External jugular vein, and the drug will pass to the subclavian vein, then to the bronchocephalic vein, and finally it will reach the heart. The next one, the patient has sudden cardiac arrest. So what is the first action management should be taken by the nurse? Check the consciousness, check the breathing, and check the circulation, and check the compression. So when the patient is having the cardiac arrest who are admitted within the hospital setup, as per the guidelines, first we need to go with the consciousness. So based on the cap, even though we have the circulation, first we need to check the level of consciousness who are admitted in the hospital setting. Next, 58. A 30 years old male patient presented to the surgery OPD with a complaints of bleeding per rectum, history of suggestive hemorrhoid. So what will be the confirmatory test in the OPD? USG whole abdomen, sigmoidoscopy, digital rectal examination, and proctoscopy. For the confirmatory test of an hemorrhoid, the digital rectal examination will be the most commonly done by the doctors to the patient to make the confirmation. So option C is the correct one. Next question. So what will you do to increase the absorption of percutaneous nitroglycerin? So apply near the heart, apply in the non-hairy area, apply in the legs, apply on the abdomen. So always when we are applying on the non-hairy area, the action will be rapid. 60. A 38 years pregnant woman is undergoing a neonate non-stress test. So during the 20 minutes of examination, the nurse noted 3 fetal movements accompanied by acceleration of the fetal heart rate, each 50 beats per minute, which lasts for 15 seconds. So this finding can be interpreted by the nurse as positive, negative, and reactive and non-reactive. So this is one of the sign of reactive non-stress test. So the nurse is caring for the child with a sickle cell anemia to prevent that thrombus formation in the capillaries, as well as other problems from the stasis and clotting of blood in the sickling process. The nurse should administer oxygen, increase the fluid by mouth, and use the humidifier. Encourage the client or child to maintain the bed rest. Administer the prescribed anticoagulant. So always the primary intervention to administer the oxygens can avoid the formation of thrombus in the capillary areas. The next one. So when the two rescuer are giving that CPR procedure, after how many cycle rescuer should change over? 1 cycle, 2 cycle, and 5 cycle, 10 cycle. So after every 5 cycle, the nurse or that the CPR person who is giving that CPR need to change over. And 63, the immediate 4 hours newborn is being placed in the phototherapy. So what is the priority care need to be provided by the nurse to the newborn? Changing the position of the baby for every 4 hours, remove the eye patches 2 times in a day, and breastfeeding as much as possible. So when the baby is placed in the phototherapy, so he is also a newborn. So the breastfeeding is the highest priority the child is needed when he is placed on the phototherapy machine. A patient in a 28 weeks of gestation is receiving labetalol and magnesium sulfate for her preeclampsia treatment. On checking her BP, you find that it is 86 by 56 mm of Hg. The most likely cause of this finding is false BP reading, accidental overdose of labetalol and magnesium toxicity, and patient is anxious. The preeclampsia, that is mainly for the treatment of hypertension. The patient will be given for the labetalol and magnesium sulfate. The accidental overdose of labetalol maybe make the persons to get down, fall off the baby. Next one. Consider the following fertility related statistic. The mortality rate of the woman is reproductive age group is not taken into the consideration while calculating which of these statistic: total fertility, gross reproductive rate and net reproductive rate, and general fertility rate. So the correct option is except the total fertility rate, the remaining three things will be considered for calculating the fertility related statistic. And 66, the patient presented with a swelling in the front of the neck and in midline, which moves the deglutition, which among the following will be the less likely diagnosis: thyroclasal duct system and solitary thyroid nodule in the isthmus and subhyoid pruritus and lipoma. So when the person is having the frontal neck in the midline, which moves in the deglutination, that is called as thyroclasal duct cyst. Sorry, that is a diagnosis. So which of the following is not the sign of dehydration in the infant? Perinatal exoration, delayed skin pinch, and dry mouth and drying of tears. And the perianal exoration is not the common sign of dehydration. So the remaining three are very commonly seen in the infant whenever the child is having the dehydration. The next one. The nurse providing care for the patient with the endotracheal tube and positive pressure mechanical ventilation. Which of the following observation requires intervention by the nurse? The intern nurse drain ventilator tubing condensation towards the endotracheal tube connection. The patient gags and bite the endotracheal tube. The intern nurse report that the patient weight has increased 1.36 kg over the past 72 hours. The endotracheal tube cuff pressure is 22 cm of H2O in water. So the last option we can eliminate because the 22 to 28 or 30 centimeter will be considered as the normal cuff pressure. And where the patient having that gags and bite the endotracheal tube, may be chance for having the misplacement or having over secretion. So the patient may need the immediate suctioning procedure or repositioning of the tube, or maybe he need to get the sedation. So the option B is the need of immediate requirement care for the patient. The next one related to the research. In a randomized trial comparing the efficacy of two anti-diabetic drugs, no significant difference was found between the two drugs. However, in reality, there was a significant difference in the two drugs. This is an example of beta error, alpha error, 1 minus alpha error, 1 minus beta error. So this is the kind of a type 1 and type 2 error. So here the person is having the type 1 error, that is a beta error. Next, 17th question. A 35 years old farmer brought to an emergency with a history of multiple time vomiting, lost stool and breathlessness for the 2 hours while he was fumigating his crops. On examination, he was drowsy, had excessive salivation, involuntary defecation, pulse rate were getting uh, bradycardia, and the BP rate were falling to 90 to 60 mm of Hg. Respiratory rate, the person having that bradypnea, 14 breath per minute, and pupils were bilaterally constricted, and twisting in the bilateral cough muscles, and the chest auscultation revealing the bilateral cracks. So what is the likely poisoning? Opioid, aluminum phosphate, arsenic, and organophosphorus poisoning. So the bilateral constriction and the person having the low BP and that decreased pulse rate and respiration were mainly commonly seen in the sign of organophosphorus poisoning. 71. You witness a 5 years child admit with you having a seizure. What immediate nursing care with the most appropriate? So here are the four options. So among the four options, the first one, maintain in lying position, flat surface, turn head to side during the seizure activity, give IV midazolam in appropriate dose and being infusion of IV anticonvulsant. So maintain in supine position, give supplementary oxygen and start IV midazolam in an appropriate dose. C. Maintain in a lying position, flat surface, turn the head to side during the seizure activity, loosen the cloth from the neck to chest, neck or chest and abdominal area. The suction as needed, supervise supplemental oxygen or bad ventilation. And D. Maintain the supine position, flat surface, turn the head to side during the seizure activity, provide supplemental oxygen and inform the doctors on duty. So among that, option D is an appropriate one. So because during the time of seizure, we need to maintain the supine position and make the person to change in the flat surface and turn the head to side to avoid the aspiration and provide the supplement oxygen, and immediately we need to make the call for the doctor. So this is the correct option. 72. So all of the following can be seen in the dengue hemorrhagic fever except fever, thrombocytopenia and leukocytosis. So commonly that leukocytosis will not be seen in the patient with the dengue hemorrhagic fever. 73. Which of the following medication have robust evidence for having anti-suicidal properties? The valproate and lithium, fluoxetine and escitalopram, olanzapine and fluoxetine, and lithium and clozapine. So that lithium and clozapine were having the less likely to have the suicidal properties. 74. Which of the following is true about disinfection in the surgical unit using glutaraldehyde? Option A, once prepared can be used for maximum duration of 7 days and 1% of glutaraldehyde is used commonly. Dilute with water in 1:5% ratio before every use. Minimum contact period for disinfection in the 20 minutes. So mostly that once the solution were prepared, it cannot be used for the 7 days. So it is the appropriate option. So actually the question were not true about the disinfection. So remaining three options are correct about the glutaraldehyde. The 75. A pregnant woman at 28 weeks of gestation visited antenatal clinic at the primary health center for the first time. Her hemoglobin level was found to be 9 grams. So she were considered as anemic. The management will be the tablet iron and folic acid 1 tablet iron and folic acid 1 tablet per week, and the first one is the day, and blood transfusion, and tablet iron folic acid 2 tablets per daily. So that all the questions having the iron supplementation of 60 mg and 500 microgram of folic acid. So in case of a normal pregnant woman will be advised to take 1 tablet which containing 60 mg element of iron and 500 mg of microgram of folic acid daily. So here mother having the anemic, so she will be advised to take minimum 2 tablets per day which having 60 mg of element of iron and 500 microgram of folic acid. So next one, the correct step to following the female catheterization. The clean the with the betadine, apply lidocaine on the tip of the catheter, insert the catheter, check the for urine, inflate the catheter and connect the urobag. And B, apply lignocaine on the tip of the catheter, clean with betadine, insert the catheter, inflate the catheter, check for the urine and connect the urobag. And option C, clean with betadine, apply lignocaine on the tip of the catheter, insert the catheter, inflate the catheter, check for the urine and connect the urobag. So here, so the correct option is clean with betadine, apply lignocaine on the tip of the catheter, insert the catheter, and check for the urine. Then we need to inflate the catheter. Then inflate the catheter and check for the urine and connect for the urobag. So that is the correct way of making the person to have the female urinary catheterization. 77. The split thickness graft, that is the graft that containing epidermis and the portion of the dermis. So, and which of the drug were not given in the CKD? Is a spironolactone drug. And the patient develops a type 2 respiratory failure. The cause of this is interstitial lung disease and flail chest and pulmonary edema and ARDS. So the correct option is ARDS. That is the major reason for development of type 2 respiratory failure. The patient having the chest injury and suspected for the rib fracture. What should be done for this patient? External fixation, internal fixation, and control the bleeding. So initially, when the person having any kind of chest injuries and rib fracture, the bleeding need to be controlled. So this is the initial action. The next one, when observing a cardiovascular client, the nurse notes that he needs to sit upright to breathe. So this behavior indicates angina, congestive heart failure, anxiety, and pericarditis. So the correct option is congestive heart failure. So this is the kind of an expected sit upright position to have the good breathing. The next one, the client is diagnosed as C4 injury, have been stabilized and ready for discharge. So because this client is at the risk for autonomic dysreflexia, the family member should be instructed to assess and report the following symptom in the home. So the options are dizziness and tachycardia and headache and facial flushing. So the correct option is B, headache and facial flushing will be noted in case of C4 injury. And 85. So which of the following site is used commonly for the injection in the children's? Gluteal muscle, subcutaneous, intradermal, and vastus lateralis muscle. The vastus lateralis muscle is very common in case of IM injection in the children's. The blue planet is known as Venus, Neptune, Earth, and Mars. So actually that Earth and as well the Neptune both are will be considered as the most commonly the blue planet. So in case if Neptune were not given, the Earth is the correct option. Hence the Neptune were given. This is the correct one. The enteric fever is diagnosed by stool culture, Vidal test, and CBC. So the Vidal test is the confirmatory diagnosis for the enteric fever. Next one, the patient with the digoxin medication, which electrolyte should be monitored? Potassium, calcium, sodium, and magnesium. So under this question, the options are potassium, calcium, and sodium and magnesium. So actually, whenever we are taking that digoxin, so that high priority will goes for the potassium. And even the calcium and magnesium also need to be noted. So which oil indicates need to be avoided in patient with coronary artery disease? Safflower oil, sunflower oil, soybean oil, and coconut oil. So most probably the coconut oil should be avoided in case of coronary artery disease patient. A patient has ruptured gallbladder. After surgery, he developed pain in the abdomen and generalized tenderness in the abdomen, fever. And this the suspected complications is peritonitis, gastritis, evisceration, and dehiscence. So the person having expected peritonitis, infection of the peritoneal cavity, and that 89, the neonate compression and ventilation ratio in the CPR procedure 3:1. It is a 90 compression and 30 breathe. 19th question. The mother is being positive for HIV, and the newborn need to give which of the following treatment? That is a nevirapine, often used to as the part of newborn antiretroviral regimen to prevent the perinatal transmission of HIV. So this is the correct answer. The next one, the drug used for the lung immaturity is surfactant. 92. The female client is instructed to collect the midstream urine. She is instructed to clean the female genital area from labia minora from inner to outer. So this is the always correct option. From inner to outer or front to back. The next one. In ICU, there is a 5 ml of blood spilled on the floor. Which solution should be effective to use in this situation? There is a 1% of hydrochloride over the period of 3 to 5 minutes to be poured on the blood spilled area to prevent the further infections. So, which of the following is not come under the condition of hand washing? So, before touching the patient, after touching the patient, before touching the patient surrounding. So whenever we are doing that patient, that means we are doing any kind of procedure, or when we are touching the patient before procedure or after procedure, we need to wash the hands. So these all things will come under the hand washing things. So before touching the patient surrounding, will not consider as one of the hand washing area. The 95 question. The true statement regarding the Gangaru mother care is there are the three components in the Gangaru mother care, that is a skin to skin contact, exclusive breastfeeding, early discharge and regular follow up. These are the three components of the Gangaru mother care. And 96. Following is the true about DMPA, that is Antara accept. That is one of the contraceptive method. It is a injectable method. It is a irreversible method. Can be used in the 15 to 45 years of age group. So it is not a irreversible method. So there is a not true. The question is not true about DMPA, or it is a kind of an accept. So we need to note down that is one of the injectable method and it can be used for 15 to 45 years age group. The next one, so the patient underwent for the cholecystectomy procedure. What will be the nursing priority will be given. So here only I know that two options, that is one is the breathing difficulty and knowledge deficit. So the further two more options were Puri. So we have Puri on this correct option. 98. The dose of adrenaline in neonatal CPR 0.5 mg per kg, that is 1 is to 10,000 dilution, 0.05 mg per kg, 1 ml of 1 is to 10,000 dilution, that is 1 mg in the 1000 dilution. So the correct option is 0.5 mg per kg, that is 1 is to 10,000 dilution, commonly used for the neonatal CPR procedure. So after the barium enema, which one of the following is prescribed for the patient? That is a laxative or enema. So the common one is the laxative to eliminate all the barium contents. So there is a not the barium enema, there is a barium X-ray. So after that barium procedure, the laxative need to be given to eliminate all the barium contents. An oxygen saturation maintained for the newborn is 98 to 100, 91 to 95, 97 to 91. So always the newborn saturation rate will be considered as normal is 91 to 95. The suture needle used for the drain tube fixation is round body needle, taper cut and reverse cutting. The round body needle will be commonly used for making the suture over the drain tube fixation. 102. Which of the following the child has low risk of sudden infant death syndrome? A child lying in a supine position has history of previous child have sudden infant death syndrome. Child lying in the prone, child sleeping in the side lying position. So the correct option is the child lying on the supine position having the low risk. The next one, the following finding in the newborn requires immediate nursing action. So the immediate nursing action, the option WBC count 18,000 per mm cubes and blood glucose 30 mg per dl and platelet 2.5 lakhs mm cube and hemoglobin 17.3 mg per deciliter. So the blood glucose level will be considered as too low. for these newborn children. So this is the immediate nursing action needed through that lab value which we are finding by the nurse. Then atropine sulfate is not used in the following condition. For the glaucoma condition, the atropine sulfate are contraindicated. How to clean the drain site? There is a circular motion inner to outer. We need to clean. The correct order of the medication. So they asked the two medication and they asked which one should be given as the first one. The steroid medication should be taken first, then the bronchodilator can be given as the inhaler form. So the correct location of the CPR in the children, the lower one-third of the sternum will be placed as the correct position for giving the CPR in children's. The next one, the patient with the opioid tolerance will be except euphoria. So the euphoria cannot be seen initially on the tolerance cases. The patient having the BP of 155 by 80 mm of Hg, pulse rate 86, and the respiration 20 breath per minute. You are administered the nitroglycerin by IV route. Which of the following is expected response for the particular drug? So the BP rate need to be get fall down and the myocardial workload need to get reduced. So the correct appropriate answer is the BP should be 100 by 60 and pulse rate 92 and the respiratory rate will be considered as 20. So this will be considered as normal after administration of the nitroglycerin drug. The 1/10th question. The antibiotic which does not require any test dose, that is the metronidazole, and the post exposure prophylaxis for the HIV infection 2 weeks, 4 weeks, 6 weeks, and 8 weeks. So the correct option is the patient should have at least 4 weeks. And the next question, the normal blood pressure of an adult is 120 systole and diastole, 120/80 mm of Hg will be considered as normal one. So another questions like an aptitude question, one alphabet question, that is a 113. The J alphabet is the correct option for this one. So another question related with the CPR, so which is the except kind of question, that is the depth of the chest need to go 5 centimeter they given. So there is a wrong answer in that. Up to 114th question we discussed, and if you remember any kind of questions or if there is any wrong answer I discussed, you can make the comments in the comment box, so we can make the correction on those questions in the upcoming videos. Soon we'll upload the remaining 80 questions in this NORCET 2023, the shift 1 question paper. And thank you for watching my video. Thank you.